Hello, my name is Rachel Cheek. I'm a graduate nursing student from Auburn University, and today I would like to discuss the topic of indoor tanning and the potential impact on adolescent health. The target audience of this presentation is legislators, specifically those in my home state of Alabama. The goal is to promote awareness of the issue of indoor tanning among minors, as well as advocate for evidence-based policy revision. Despite being labeled as carcinogenic by the World Health Organization, 1.9 million high school students in the United States continue to tan indoors. Indoor tanning is associated with both short-term health risks, such as sunburn, as well as long-term health risks, such as potentially fatal malignant melanoma. Individuals who tan indoors before the age of 35 have a 75% increased risk for developing malignant melanoma. In addition, individuals who tan indoors before the age of 25 have a 102% increased risk for developing non-melanoma skin cancer. In the United States, only 17 states prohibit indoor tanning for minors under the age of 18. In addition, additional states either have no state restrictions at all, have a lower age limit, or require parental consent. In addition to inconsistent state laws in regards to this issue, there's also been reported lack of compliance with these state laws. In a cross-sectional telephone survey conducted by Williams and colleagues among 427 tanning salons in 42 states in the District of Columbia in the United States, the overall compliance rate with these indoor tanning laws was only 37.2%. Alabama had the lowest compliance score of 0%. Compared with alternative legislation, states that prohibited all minors under the age of 18 from engaging in indoor tanning had the highest compliance rates overall. In addition to this evidence, notable healthcare providers and organizations such as the World Health Organization, the American Medical Association, the American Academy of Pediatrics, the American Academy of Dermatology, and the United States Food and Drug Administration all strongly encourage a legislative ban of indoor tanning for minors under the age of 18 due to the potential health risk involved. The resolution for this issue is a twofold approach: greater public awareness in conjunction with more uniform, evidence-based legislation. It has been recommended to align adolescent indoor tanning legislation with that of underage tobacco sales. For example, in the United States, the Senate Amendment requires all states to enforce legislation prohibiting the sale of tobacco to minors under the age of 18. This legislation is enforced with a licensure requirement, unannounced inspections, mandatory warning signage, proof of age documentation, and clearly stated penalties and fines. Financing for this effort could be achieved through increased taxation of the tanning industry, as it does with the taxation of the tobacco industry. President Obama initiated this effort in 2010 under the Affordable Care Act with the passage of a 10% excise tax for indoor tanning salons. It was estimated that this tax would provide $2.7 billion by 2020 in relation to this effort. A modeling study was conducted to evaluate the potential impact of uniform federal legislation prohibiting all minors under the age of 18 from engaging in indoor tanning. Results included an estimated prevention of 61,839 melanoma diagnoses, 6,735 melanoma deaths, and $342.9 million in saved treatment costs over the lifetime of adolescents 14 years of age or younger in the United States. Recreational exposure to a scientifically proven carcinogen is a health-related problem and worthy of involvement. As a teenager, I participated in indoor tanning as a minor, unaware of the potential consequences, and now have had several precancerous skin lesions removed. Now, as a mother of 3, I hope to increase awareness of this issue and promote increased restrictions to not only protect my own children, but also the nation's youth from the potential and dangers involved in indoor tanning. Thank you.